We follow students in Birmingham and Manchester,
I want to listen to your chest.
juggling academic study
Nothing's going in.
with home life and work on the wards.
You're never going to learn how to be a nurse until you're out there doing the nursing job.
This time,
Keep yourself calm, all right?
mounting pressure,
Well, you've got a herd of elephants in there right now.
a testing youngster, and first day nerves.
I might walk in there and start crying my eyes out and walk out. I'm not sure yet.
As our nurses-to-be step up to the challenge of 21st century nursing. Only a quarter of practicing NHS nurses have a university degree, but that number is set to change. At unis all over the country, a very different generation of nurses is being born.
So this is what we're looking at today, the renal system.
24-year-old first-year Alistair is among the growing number of men taking on the challenge.
Bricking it. I'm scared. I'm pretty scared, to be honest. I'm not used to being around so many women all the time.
You all right? Yep.
It's a world away from the job he was trained up to do by his dad.
Proud of him, really. But don't tell him.
He's swapping a hefty paycheck for a different kind of reward.
You won't save lives fitting carpets, but if I can save one life being a nurse, then what an achievement that is in life.
After 2 months in the classroom, Alistair is about to set foot on the ward for the very first time.
Worrying most about just how I react to, seeing people in such poor condition or, people who really seriously need help. I've never seen it before, so I think it'll be quite a shock to the system.
I'm starting to get a bit nervous now, actually. See, I think I've come wrong way. I think I've got to get in a lift down here.
I'm scared, to be honest.
Just lifting for feet at you, something. I can't get in that.
First challenge overcome. Alistair's found the orthopaedic ward and staff nurse James.
This is Bay 1. This is where we'll be working today. Numbered bed 1 through to 7. Kitchen. You found the kitchen. Find yourself some cups. Find yourself a brew.
Right.
That's the important bit. Used to be the bathroom. It's now a stock room. Hoists and traction equipment in here.
It's time for Alistair to get to work.
A lot to take in.
Yeah.
So don't get lost.
Right, OK. I'll do my
Okay.
best.
There you are.
Yeah? Yes, that's me.
That's you.
That's me.
No way.
Yeah.
In Birmingham, second-year Dany is picking up on a career she first began training for 3 decades ago.
When I started at 19, I was nothing like I was now. I was shy. I wouldn't have said boo to a goose.
Dany's first shot at nursing was cut short by illness, but her teenage desire stayed with her.
I've always wanted to do it. I started it and couldn't complete it, and it never left. It never left. 30 years later, for it to come full circle, I just can't believe that, Gosh, you're gonna make me cry now. Yeah, I am. Yeah, I can't believe that I'm back doing what I started.
Dany's chosen adult nursing for her degree. Today, she faces a grueling 12-hour shift on the fast-paced acute medical unit in Good Hope Hospital.
It is a bit calm, but you know what a calm comes before.
She hopes to impress her mentor, staff nurse Helen. It's a far cry from the admin jobs Dany's had before.
I've done lots of office jobs and change, but this is so different. You're more responsible for other people. It's not like, if I make a mistake on the computer, it's going to, affect somebody's life.
Midway through Dany's shift, a seriously ill patient arrives from A&E.
Just bear with me, Hilda.
85-year-old Hilda's heart rate is dangerously high and her breathing painfully laboured.
We've just got to monitor her heart rate at the moment because it's not in normal rhythm.
Just like as if my bra's cutting me really tight underneath.
You just keep yourself calm, all right?
I mean,
Bleep
I'm
is
in
up,
underneath and it's just digging into me.
It's going so fat, yeah.
All I feel.
Well, you've got a herd of elephants in there right now.
Hilda's condition is deteriorating. They need the crash trolley on hand in case she suffers a cardiac arrest.
What goes through your head is like, am I going to be able to fulfil the training that you know what I mean? If you need to do the CPR and that, if that emergency happens, are you able to react to it? You know, it's a bit different doing it in uni as to doing it when it happens.
Just make sure that's accessible, please. It's the crash I want, the crash.
Dany is told to keep a close eye on her patient. Monitoring her symptoms is crucial to assessing Hilda's condition. It's Dany's first major test on the ward.
You're just worried that you're not going to be a hindrance on the ward. You want to go in, seem like you've got some kind of confidence in what you can do, but I hadn't really.
In Manchester, 21-year-old Helen is nearing the end of her 3-year degree. By the time she finishes, she'll have clocked up 2,300 hours of study, and the same again on the wards.
When I started, maybe I was a little bit naive to how much work there was, but now I definitely know. I think the work-life balance has kind of gone out the window, and I am doing a lot more work than life, if you know what I mean. But I know at the end it's for a good cause.
Helen is just one term away from fulfilling her childhood dream of becoming a children's nurse.
At school, my answer was always, I want to be a nurse. Obviously, I think I probably wanted to be a princess or something like that, but it's quite nice now that I am nearly there and I've only got that one last little step to take before I actually am a nurse and the nurse that I've wanted to be, like, the whole of my life. At the moment, I'm not scared. Ask me in 6 months' time when I start a job.
Like all student nurses, Helen's time is divided between theoretical study and hands-on training. On the children's unit at Salford Royal, she's under the watchful eye of staff nurse Katie. Her first patient is 6-month-old baby Caius.
Hi, Mum. Hi, I'm Katie. This is Helen, she's one of our students. How can we help you?
It's really hot. It's just getting hotter. And there's like some spots come up on the bottom of his back.
Okay, I'll just do his temperature first. Yeah?
The nurse's immediate concern is the killer disease meningitis.
38.9. Some parents, as soon as they see a rash, they link it straight to meningitis, so we tend to get quite a few patients in who come in with rashes, especially young babies, because the parents just want to get them checked out really just to be safe.
And when you press it and it goes away, it's called a blanching rash, which they are. Okay, so that's a good sign. Okay, it's the rashes that don't go away that we worry about. Okay, but we'll send you up to the Panda unit and one of the doctors will see you up there. Is that okay?
Yeah, that's fine.
Hello, Panda staff nurse.
Meningitis has been ruled out. To help diagnose his illness, Helen needs a urine sample from baby Caius. Easier said than done.
Sometimes when you take the nappy off and you know the cold air hits it, that makes them. We only need a bit, so even if, you know, if he starts wheezing, it goes all over, just try and grab as much as you can. Don't worry if you don't get it all. Okey-doke. Once he's had a wee, we'll put the sample in a little pot and then we'll just test it with urine strips, just to see if anything's in it, really, any protein, any blood, anything that's not meant to be there. So we'll see once he's had a wee. Has he weed? Has he? It's fine, as long as you...
She didn't get in after all that.
Right, let me...
Okay. There's a little tiny bit.
I think it's really important to be able to interact with the parents by having a little bit of a laugh with them. It shows them that you are human and you're not just a nurse and you're not like a bit of a robot.
I can't imagine too much.
There you go.
Yay.
Not too much now, come on.
Okay.
Don't be getting greedy. There you go, pop it now. I should know, as a third-year student experiencing babies and how active they can be, that I shouldn't have left it there because I should have knew that I'd kick it over. Do you know what? Actually, I think that's going to be enough. Let me... Right, I'm moving it well away from your foot, mate. I would never class it as a mistake. I'd just class it as like a bit of a learning curve, I suppose. But yeah, I'll never do that again.
Caius's hard-won sample was clear, and with his temperature back to normal, he was later discharged. At the Royal Bolton, former carpet fitter Alistair is about to get to grips with his first ever patient. Raymond needs a bed bath.
I know I'll be scared. I'm going to go in there, with a level head and just try and make the most of, my first experience. And I feel personally I've got a lot to prove because the majority of the cohort have got a lot of experience in healthcare.
Can you just lean forward a little bit while we just get your t-shirt off up your mat? There you go.
There we go.
Over your head.
Yeah.
That's it.
Underneath the arm.
Underneath.
There, ground. A bit more vigorous than that.
Yeah. Just let me know if I'm hurting you. I didn't want to do anything wrong, or I didn't want to hurt him. You do your clinical skills lessons, but when it's in practice, it's totally different. Just do under there. You've actually got moving patients who talk and have feelings and things like that, so it's a bit strange to get used to, I suppose, but it's not for my ego, I'm here to care for them, so I'm trying my best.
At Good Hope Hospital in Birmingham, returning student Dany has been on duty for 8 hours. She's been asked to monitor great-grandmother Hilda, whose dangerously high heart rate is causing concern.
Put your arm up for me, chick.
On top of a high temperature and vomiting, Hilda is bleeding from the cannula in her arm.
Oh, thank you. I thought I was going to go out today, but then I only come for x-rays.
Because of her heart problems at the moment, going up and down, you're never too sure, I think, when it might suddenly become an emergency. And she keeps complaining of chest pains. I think you always have to be alert.
I'm being a nuisance, I don't have it here.
Not at all. Not at all.
I'm not being a nuisance.
You're not being a nuisance at all. I hope everything will be fine overnight, but you've also got that sort of, because I had it happen on another ward where I left the night before and then come back the following night and something bad had happened. I hope you have a good night's sleep, all right, and we'll see you in the morning. All right, good night.
Dany has finished her 12-hour shift. She leaves not knowing what the morning will bring. Second-year student Dany first started training 30 years ago, but then illness cut short her dream. As a new shift starts on the acute medical unit, she's unable to keep her patient from yesterday off her mind.
As soon as I woke up, I was thinking about Hilda. She was really ill yesterday, and I think you're always sort of, it's just that sort of bit of a flutter in your own heart and that lump in your throat. Is everything going to be all right?
Hilda has been very ill during the night, vomiting and with a raised pulse.
Up and down all night. Yeah. As much as you like to keep that professional distance as such, you know what I mean? You can't help get involved with some patients, and for some patients it's probably stronger than other ones, because that's the nature, isn't it, of people.
I know, just stay where you are for the minute because your heart rate's going again, isn't it?
As the morning progresses, Hilda is still suffering. Dany's been instructed to call for specialist help.
Trevor's the cardiac specialist nurse, so I think they just want to bring him down to review Hilda.
Nurses like Trevor are experts in their field, taking on many of the roles once carried out only by doctors.
I actually think, looking at her old ECGs, that this lady's in flutter. Apparently she came in yesterday. She was having these episodes of really fast heart rates.
She was.
The heart rates were around 150.
Yeah.
Atrial flutter basically is a situation where the upper chambers of your heart are doing, instead of beating like this, they're doing this.
Trevor will carry out a fresh ECG on Hilda. It's a procedure Dany's never seen up close.
It's always better when you learn the best practice and then hopefully you'll keep the good habits. You're all right, Hilda?
Excuse us a minute.
Yeah.
Separate the two wires furthest away from you. The inside one goes on her arm. The outside one goes on the leg.
All right, Hilda?
She's the ideal patient.
Yeah,
If she's having atrial flutter, the next thing you'll go to is atrial fibrillation. And the danger with atrial fibrillation? Stroke.
Well, that's like it wasn't treated, it would be stroke.
It's the big thing, is the stroke. So that's what we have to try and actually make sure we get a complete diagnosis. So I'll discuss this with the consultant when he comes.
So
That would be my money.
some treatment.
Hilda has been lucky. Her underlying heart condition has been diagnosed and can now be controlled with the right medicine.
Got your medication, have they?
Well, look at all what you've done for me.
You've been more than
Blessing
welcome.
you have.
You've been more than welcome. I'm just glad that hopefully they've got the diagnosis now and they can treat it. In my previous job, by the time I left it, I wasn't getting any job satisfaction, but you've only got to get one person who's appreciative of the care, and that is enough sometimes in the day to make it worthwhile.
In Manchester, third-year Helen is just months away from qualifying. As well as being on the wards, children's nurses work out in the community treating young patients at home. Helen's mentor, Kelly, has asked her to lead the next visit.
She's coming up to qualifying next year and she does need to get used to being able to work independently and make independent decisions.
12-year-old Josh spent 5 days in hospital after a cut on his leg became infected. For the last 2 weeks, Kelly has been dressing the deep wound. Now, it's Helen's turn.
About a month after we got back, it started healing. I was picking at it and it got infected, so I had to go to hospital.
Picking scabs is definitely a common one for their wounds getting worse and them getting infected. A lot of children like that gruesome and gore bit, and seeing it, especially boys. I am a little bit like that in some way. I do get very, very excited at the thought of a wound. Is that all right?
It feels like shooting pains constantly going through my leg.
If you need us to stop for a rest, just say.
Can't do that, mate.
Helen loves it.
Right, I'm just going to pop. Is that okay for you?
Yeah, absolutely fine.
Is that all right?
Yeah, just make sure that it's well packed and your dressing is on there, secure it. If you could give Helen a mark out of 10, what would you give her?
You don't have to be nice because I'm stood here.
Well, you're not done it the most painful, say about 10, 9.
9? I'll take a 9. This is a great end of my day. I do like a good wound.
Her shift over, Helen still has 4 hours of coursework ahead of her.
Nurses are taking on a lot more responsibility now, so I think you do need that degree. But as a student nurse undertaking a degree, there is a lot of work involved and it is really hard because what people don't understand is it's not just a degree. I'm still doing a degree now, plus full-time hours every single week. So just because I'm not in university doesn't mean I've not still got 4 assignments to be getting on with.
As Helen nears the end of her training, former carpet fitter Alistair's is just beginning.
I'm doing a lot more than I expected, to be honest. Straight in the deep end, which is good, I like it like that. I feel like I learn a lot more, if I'm on a job and I'm doing stuff. It suits my learning style.
On a ward where many patients are immobile, preventing bed sores is a crucial part of nursing. Raymond is particularly vulnerable.
Right, lean forward in the middle. Lean forward in the middle. And then after 3, okay?
1,
3,
2,
3.
There we go, Raymond. There's going to be highs and lows, and you've got a lot to deal with. It's not every job where you see people in such pain, and it's one of the hardest things to deal with.
Can you push your bottom in now?
And straighten your back a little bit.
Straighten your back.
Can you do that? That's good.
Alistair's next patient, Jeff, is unable to stand after breaking his leg. It's all hands on deck to move him.
You all right there?
Growing in confidence, Alistair is quick to take the lead.
3, 2, 1. Yeah? It was good to count it in. I thought I'd jump in there quick, at least they know I'm, getting involved. Transferable skills, so, I was like, yanking that carpet out, sorting out, so. Comfortable, yeah?
You've been like this, haven't you?
Jeff's injury is he's ended up with a pin straight through his leg, to keep his leg in line. I just keep trying to tell myself, it's not about me, it's, the pit. Trying to think about how the patient is when they're lying in the bed, they don't want someone, saying, whoa, look at that, or what's that smell, because they're already obviously not feeling themselves. How's that?
Oh, that's brilliant.
Yeah?
Alistair's very first shift is nearly over. With 6 patients under his care, it's been an eye-opening introduction to his new career.
Not here for the money. I'm here for, that reward that comes with nursing.
Just there if you need anything. Okay. It's not quite skinny jeans and a skimpy t-shirt, but I reckon I can pull it off, yeah. How's that?
Nice one, mate.
Yeah,
Thanks. All the best. You'll be fine, mate.
Cheers,
fine.
man.
Good, and good luck.
Yeah.
When people used to ask me, what do you do? I'd say, I'm self-employed, but I wouldn't say, I was a carpet fitter, because in my eyes, at the time, you want to try and impress the girls and stuff, But now, if anyone asks me, it's like, yeah, I'm a student nurse.
Next time, hard graft.
I don't know how nurses do it. When they say long days, they're not joking, are they? They have long days.
High emotion.
If I can do it for him, there's a good chance that I can do it for somebody else.
And child's play.
The fun, the laughter, they just make your day's work worth it.